Okay, in this video, we're going to be looking at the cranial nerves. So we're going to identify them from this inferior view of the brain, and we're going to discuss the number, the name, the system, and the function of the cranial nerve. So we're going to start at the top with cranial nerve number 1. It is olfactory, and it is a sensory neuron. Okay. So sensory relates back to the 5 senses, and you're going to notice that there's some that are sensory, some that are motor, and some that are both sensory and motor. Okay, so also keep in mind that there is a left and right one, so it's 12 pairs of cranial nerves because you have smell on both sides, sight on both sides, and so on and so forth. So we've got cranial nerve 1, olfactory nerve, is sensory and deals with smell. Number 2 is going to be optic, the optic nerve. It is sensory also and deals with sight. Okay? Olfactory, smell, optic, sight. Number 3 is going to be called oculomotor, and it's going to be motor. Okay, so it's going to be different than the first two. Oculomotor, the third cranial nerve, is going to be just motor because it does eye movement. Okay, so number 3, oculomotor, eye movement. Number 4 on the left side is going to be trochlear, and it's going to be motor also. So the 4th cranial nerve is trochlear, it is motor, and it does eye movement as well. Number 5 is going to be trigeminal, and it is going to be the first one that we've discussed that is both. So the trigeminal nerve is going to be both sensory and motor. Okay. The sensory side is going to be facial sensation. The motor side is going to be jaw movement. Okay, so you've got facial sensation and jaw movement. Okay, number 6 is going to be abducens. That is going to be motor, and it's going to be the 3rd cranial nerve that deals with eye movement. So you'll notice that cranial nerve 3, 4, and 6 all have the same function. They're going to be controlling different muscles to move the eyes, but they're all eye movement related. Okay. So number 6, abducens, is motor because it does eye movement. Now, number 7 is going to be facial. Okay, and it's going to be both as well. So you're going to have the 7th cranial nerve is facial, and it has both sensory and motor function. Okay, so it's going to be responsible for facial movement and taste. Okay, facial movement and taste. Now, it's going to be different than what we're going to talk about in a minute because the taste component of this nerve is the anterior portion of your tongue. So the front portion of your tongue is where the taste component comes in for cranial nerve 7. Okay, now we're going to do number 8. And it is going to be vestibulocochlear. And it's going to be sensory only. So number 8 is vestibulocochlear, and it's going to be sensory only. It's going to deal with hearing and balance. Okay, so it does have 2 things, but both of them are sensory, hearing and balance, because they kind of go hand in hand. You've got number 9. Is going to be glossopharyngeal. The glossopharyngeal nerve is going to be both. It's going to have a sensory and a motor component. Okay, so keep in mind, when I say sensory, I'm relating it pretty much back to the five senses. When I say motor, I'm talking about movement that's associated with muscles. Okay, so the ninth cranial nerve, glossopharyngeal, is going to be responsible for swallowing and taste. Now, the taste component now is the posterior portion of your tongue. So you've got swallowing and taste for cranial nerve number 9. Number 10 is going to be vagus, and it is going to be both sensory and motor. Vagus is going to be responsible for what we're going to call autonomic control. So that is your heart beating, your ability to breathe, like your lungs functioning passively and just breathing all day long without you thinking about it. Any of the processes within the body that happen automatically, okay? So the vagus nerve controls autonomic functions. If you go to number 11, that's going to be accessory. So cranial nerve 11 is accessory. It's going to be motor. The accessory nerve controls the shrugging muscles. So the muscles specifically that it controls is going to be sternocleidomastoid and trapezius. Okay, sternocleidomastoid and trapezius. The 12th cranial nerve and last cranial nerve is going to be called hypoglossal. So the hypoglossal nerve is going to be motor, and it's going to control tongue movement. So hypoglossal is tongue movement. Okay, so I'm going to replace these with a little bit clearer handwriting. So you can see from 1 to 12, their numbers, okay? And then as you start to review, you can pause the video at this point and look at your ability to say whether it's sensory, motor, or both, and then how well can you remember the specific function of each of the 12 cranial nerves.